Growing up in a family of 3 boys, we played sports year-round, involved in athletics. With that came injuries and other things that we ended up in an orthopedic surgeon's office. And basically just kind of piqued my interest with regards to what orthopedic surgery was, probably more of the sports medicine component. But then as I got into college and med school, I really enjoyed a lot of the physiology behind a lot of orthopedic injuries and with regards to the recovery process. My favorite procedure would probably be anything you can do with a scope in the shoulder. Like, I really like shoulder arthroscopy. I did a fellowship in shoulder surgery and just really enjoy different procedures with regards to that. Probably the biggest one is a rotator cuff repair. With regards to physical therapy in my practice, there's a combination. So I do a lot of self-directed therapy initially in the first few weeks after surgery, instruct patients with regards to things they can do on their own, and then pretty much with almost every procedure I do, at some point, whether it be immediately or within a few weeks after surgery, I get them into the physical therapist. More because the physical therapist is going to be able to devote a lot more attention with regards to where their deficits are. Not every patient's the same. I think most people need to know that there's not an easy surgery that you just go in and it's a quick fix. There are things that are broken and we go and we fix it and they're able to begin the process of recovery, but only 50% of what I'm going to do is the surgical part. There's a 50% of that is going to be up to the patient with regards to rehab, with regards to following the precautions and the things that they need to do after surgery to allow themselves to recuperate and return to their level of function or activity prior to surgery. What makes me stand apart as a surgeon? Just being down to earth, trying to have a really good bedside manner, just trying to put myself in the patient's position with regards to how I would want to be treated, or if it was my family member. I tell my patients all the time, like, if you were my family member, this is, what I would recommend.